We're at this incredible turning point in healthcare. Forever, the whole system has been reactive, right? It only really kicks in after we get sick. But now, a new kind of AI is totally flipping that script. It's building a future where technology is working on its own to keep us healthy, right from the get-go.
So get this. What if AI could literally see the future? And no, I'm not talking about some sci-fi movie. I'm talking about real technology that can spot something like Alzheimer's disease up to 5 years before a single symptom even shows up. This isn't coming soon, it's happening right now.
Okay, so the big question is, how? How is this even possible? How can technology not only get a glimpse into our future health, but actually start doing something about it today? Well, the answer is all about a powerful new kind of AI.
The best way to wrap your head around this is to think about your car. For years, we've had what's called predictive AI. That's basically the check engine light. It's useful, sure. It tells you there's a problem, but you still have to figure out what's wrong, call the mechanic, and book the appointment. The new kid on the block is Agentic AI. Now imagine this. The car not only detects the problem, but it checks your mechanic's calendar, finds an open slot that works for you, books it, and puts it on your schedule. See the difference? It doesn't just warn you, it acts.
So what really makes Agentic AI special is its autonomy. We're not just talking about fancy notification systems here. These are systems designed to carry out complex, multi-step jobs to actually solve problems, all within, of course, really strict medical and ethical guardrails. The bottom line is, they're problem solvers, not just problem spotters.
All right, so how is this really changing the game on the ground? Let's dive into 3 key areas, and we'll start right on the front lines with doctors and nurses in the clinic.
And the impact here, it's huge. We already mentioned the proactive diagnostics for things like Alzheimer's, but it goes so much deeper. Think about medical imaging. An agent doesn't just flag a weird spot on a scan. It can autonomously triage the entire queue, pushing the most urgent cases to the top of a radiologist's list. And in a place like the ICU, wow, they are becoming absolutely essential for monitoring patients in real time.
Let's make this super real for a second. Picture a patient in the ICU who starts developing sepsis, which is incredibly dangerous. A traditional AI, it just sounds an alarm, beep, beep, beep. But an agentic system, it's monitoring vitals, it recognizes the very specific signs of sepsis, and it can immediately kick off the hospital's official protocol for diagnosis and treatment. We're talking about actions that can happen before a nurse even gets to the bedside. And in a situation like that speed, it can literally be the difference between life and death.
But this tech isn't just locked away in hospitals. The second major area where we're seeing a huge impact is how it's building a bridge from the clinic straight into our homes, into our daily lives. It's making proactive care a personal 24/7 kind of thing.
And this is where it gets, really personal for a lot of people. If you have diabetes, for example, an agent could analyze data from your wearable device and on its own adjust your medication schedule. Or let's say you just got out of the hospital. An agent could manage your whole recovery, tracking how you're feeling, booking follow-up appointments, and just making sure you're staying on track. These aren't just apps on your phone. They're becoming our personal health guardians, for real.
For anyone managing a chronic condition, this is just a monumental shift in thinking. It's the difference between just passively getting care and having an active partner in your health, one that's constantly working in the background to stop the next crisis before it even has a chance to start.
Okay, so we've talked about patients and doctors, but there's a third absolutely crucial area where these agents are doing some heavy lifting, and that's fixing the complicated and, let's be honest, often broken administrative stuff that happens behind the scenes. Just think about something as simple as booking a doctor's appointment. Right now, it can be a total nightmare of phone tag and paperwork. Well, an agent can handle that whole process seamlessly from start to finish. It can take your call, check the electronic health records for an opening, book the slot, and then automatically send you all the right forms to fill out. All of it.
And the result of automating just that one process, get this, a reduction in patient shows by up to 40%. That is a massive boost in efficiency for the whole system.
And believe me, it doesn't stop at scheduling. Agents are now verifying insurance on their own, submitting those annoying prior authorizations with all the right documents attached, and even drafting appeals when a claim gets denied. This is all that administrative grunt work that just bogs everything down, and finally, it's being automated. And what about the doctors? For them, this is nothing short of a revolution against burnout. There are these amazing tools, ambient clinical intelligence, that can basically just listen to a conversation between a doctor and a patient and then automatically generate all the clinical notes. Just that one thing is saving doctors 2 to 3 hours every single day.
That's time they get back to actually spend with their patients instead of being buried in paperwork.
So after hearing all of this, I know it's easy to think, okay, this all sounds great, but it's probably years away. But the most important thing to take away from this is that this isn't science fiction. This new era of care, it's already here.
And look, we're not talking about small, experimental startups. The biggest names in healthcare, the world's leading institutions, are already putting these systems to work. We're seeing it at the Mayo Clinic for tailoring treatments, at Genentech to speed up drug discovery. This tech is being woven into the very fabric of top-tier healthcare. It's happening right now, and it's happening at a massive scale.
So really, what we're all witnessing is the fundamental rewiring of healthcare itself. The core logic is changing. It's moving from being reactive to being proactive, from manual to autonomous. The entire system is being redesigned around one simple idea: keeping you well, not just fixing you when you're sick.
And all of this leaves us with a really fascinating and, I think, deeply human question. As all these technical tasks, diagnosing, scheduling, monitoring, as they become more and more automated, what happens to the role of our doctors and nurses? What becomes their primary mission? In this new world of agentic healthcare, what is the most vital, the most important role that only a human can fill?